Hello everybody out there, I'm Bob Willard. I'm with the Knee Institute in Regenerative Medicine, and we're really happy to come into your homes and share some exciting new information. I will be doing this twice a month, and we're going to call it Medicine Yesterday, Today, and Tomorrow. And today we're happy to be honored to be with Mr. Darryl Nix, and Darryl is a physical therapist. He has been an instructor at Wayne State University. He's also been director of physical therapy at Bi-County Hospital. He was also director of physical therapy at Pontiac General Hospital. He has over 35 years of experience, so we're very excited to have you here today, Darryl. I'm going to ask you some questions here. So the first question I'm going to ask you is, could you be kind enough to define what traditional physical therapy is that we see throughout the community?
Yeah, that's a hard one to define because there has been no standard of care, meaning there has been a practice that has been standardized. So you could go to a physical therapy clinic down the street and get something different than something a mile away. But if you had to get an idea of what physical therapy does, is there are things we call modalities, which is like hot pack, ultrasound, electrostimulation. Then there's forms of exercise that are done to strengthen muscles. There's stretching exercises, and then what's called manual therapy, where the therapist actually puts the hands on the patient and actually moves muscles or joints in the direction which they want to move them. So that sort of encapsulates some of the common things in physical therapy that we would call traditional medicine. But I'd like to add, there has not been a specific definition of what outcomes that we want to get from all of this. And so, again, you might go from one clinic to the next and have to do something different because that was the way they do things there.
So when you say outcome, does that mean I'd come in and I have a knee problem there, and you do, I think, what you call an evaluation there. And after that evaluation, then you would determine what the problem is and then the necessary process to take care of that. And then you would describe to me or describe to the audience what kind of an outcome would you be looking at in utilizing traditional physical therapy.
Absolutely. That's exactly right. You want to give that individual some idea so they can predict what's going on and what type of outcomes you're looking for. Eventually, you want to certainly get rid of the major things that are for us, for pain, for weakness, for stiffness. Those are kind of the common things that keep people from moving and doing things that they want to do.
Well, because it's interesting, I'm going to hit the big 7'5" next year, and so as I'm aging, as we age, we start to have a lot of joint problems. And I found it interesting, I was having problems with my knee, and I had my physician refer me to physical therapy, what you're talking about.
Yeah.
And I've had it several times, and what I find is I've gone to different places, and it's the same thing. They give me, I think it's called hot pad, and it really feels good when it's on there. But then by the time I get home, I don't notice any difference. And then they do this thing, it's ultrasound or something, where they have this little wand thing and they put some gel on it and it goes around on for 5-10 minutes. And I sort of got some relief from that. But then shortly after that, I didn't feel any difference than when I came in.
Yeah.
Now, the thing they did is they put me on a treadmill and they had somebody massage my knee. The interesting thing is, I've gone through this process several times, and each time, wherever I go, it's the exact same thing there. Is that pretty much the way that traditional physical therapy is out there? Is it pretty much a norm, even though I know people do different things, but they do basically the same? Am I correct in saying that?
Yeah. You know, those are some of the common things that have been done in the industry for many decades. Mm-hmm. You know, there might be different types of exercises people do, or maybe different types of stretching that are being done, but that's a pretty accurate account of what you will get in physical therapy, yes.
Well, what's exciting about having you as a guest today is I know you're the author of what's been defined as three-dimensional functional therapy.
Yep.
It's very unique and different, and the research that I've been able to do, I haven't found any place in Michigan, in fact, in the whole United States, that even does anything like this. And I've contacted several universities. I've contacted several rehab centers and whatnot, and they're not familiar at all with what I was talking about. So I was wondering if you'd be so kind as to define what that is and to share how it works and some of the outcomes that we get.
Oh, absolutely. It'd be a pleasure. Going back to the fact that I've been in the field, clinical field, for 35 years, and I've been with patients for that long time. I've probably treated 100,000 cases.
Wow.
So I come from a different perspective. One of the things that I recognized was we have to look at outcomes first. What type of outcomes are we looking for? The big outcome, obviously, is that the person's pain-free, moving as normal as they can, and doing the things that they want to do. But how do we get there? What are the little outcomes that we get in order to get to the big outcome? And what I've developed is a 4-step program to get to that point. The first step, which from what I've been treating people over and over again, is get rid of swelling. As simple as that sounds, it's not being done.
Is that what I hear sometimes? Is that the same as they say edema?
Yes. Yeah, if we're looking at the knee or any joint in particular, the fluid inside the joint becomes swollen. And how that happens is because at some point in their life, they had some inflammation. They might have strained it, they might have injured it, or they might have had some metabolic problem that caused swelling. Well, that swelling produces heat. And if that doesn't get out of the joint, they're going to have problems, major problems. It's going to cause irritation of the joint. It's going to cause excess pressure inside the joint. It's going to cause weakness. It's going to cause a lack of mobility.
Can you sort of demonstrate that with this model you brought?
Sure. So if we're looking at the knee joint, and you know what, I'm going to take, I think, one of these here.
It's not one of yours.
Pop that off here.
Here, and we'll just put this on here for you.
Yeah.
You got it?
I think so. There we go. Yeah, if we look at the joint, what we're talking about here is this is what's called the capsule that holds all the fluid inside the joint. If there was no capsule there, fluid would leak out.
Okay.
So you have this tough fibrous tissue that holds that capsule in place. And inside the joint is where the edema can take place or the swelling take place.
Okay. And that's just fluid.
That's just fluid. Now, the way the fluid leaves the joint is actually through the bones. And by movement, the fluid goes into the bone and actually nourishes the bone. And that's a good thing. We want that to happen. But if the swelling increases or becomes thick and it loses some of its properties.
When you say thick, help us and our audience, what do you mean by that?
Well, anytime you have fluid inside a body part or even outside a body part, and it's stagnant, it's not moving, it gets like a swamp. It gets thick and hard.
Okay.
It's not moving. So just to make it easy to understand.
I got it.
And so this is what causes, quote, stiffness in the morning when you get up, or stiffness when you get up from a chair.
Is that the same thing when I'm driving on a long trip and I stop at the rest area and I get out and I'm stiff all over the place?
That's
Is
right.
It the same thing?
And what happens is you move it, right? Then whether it takes a minute or 30 seconds or 2 minutes, you feel better again. Well, what happened? You started moving the fluids.
Okay.
That's as simple as that. So we want to take care of the swelling that's inside that joint first. So what do we do? Well, what does happen is they'll get sometimes an injection from the doctor's office. And that's a very powerful anti-inflammatory if they take cortisone that helps chemically dissolve some of the irritants in there so that the knee can move properly.
So what you're saying, if I understand correctly, is sort of reducing the inflammation?
It does reduce the inflammation. But there's so much that can be done in physical therapy to reduce the inflammation as well. One person...
So we can do some of this and achieve some of this without drugs? Is that what you're telling me?
Absolutely, without drugs and surgery. And not being so complex or unusual solutions to a basic problem.
The reason I was asking that question, and I know you're probably aware of this as well as our audience here, we're going through an significant opiate problem here. So this is sort of interests me because correct me if I'm wrong, it seems like that would help us keeping people off of these opiates.
Oh, absolutely, it would take, absolutely it would. Exactly, we're looking at a simple biomechanical model that can handle pain, but it has to happen in a sequence way, so the person doesn't have to feel like they're taking drugs to get rid of the pain. Of course, the pain medication that they give is not a solution. It's masking. It's making them feel better, but of course, obviously, the side effects from that, we don't want.
So it's very exciting what you're telling us, especially with this opiate crisis going. This, whatever contribution is, a small or significant, it sounds like it could be significant. People understood this, could really impact us in a positive manner when we're relating to such things as opioids.
Absolutely, and it's already.
So the Vicodin people, if they were to follow this kind of a procedure, it would maybe not eliminate it, but it would certainly reduce it. Am I correct in that saying?
Absolutely. I'll tell you one thing. When a person has surgery, the best thing that I've seen to help the pain level is get them on a motion machine. It's called a continuous passive motion machine, and it does this. It moves the joint back and forth a little bit at a time.
I've seen that. Now I know why they're doing that, because you see them going back and forth and back and forth.
You can set the speed on it, but what it does is it keeps the fluid from accumulating, and it takes relief off. Now the other thing that happens is you want to keep the joint as straight as possible without the imagined pain, because again, that fluid is compressing those tissues and making it irritable. So on top of the movement, you don't want to be sitting or bending your knee for long periods because it opens up the joint for even more fluid.
Okay.
So with the movement there, you want to be in a position where the leg is as straight as it can at the kind of comfortable level, because you can't stretch fluid. When you try to straighten out the knee, you're going to push the fluid together, and it's going to cause irritation. So again, you'll see people walk around with a bent knee for that very reason, because it's swollen.
Wow.
So one of the things is, again, we're just talking at the first step right now, is getting rid of some of the fluid in there and getting it circulating so it doesn't get that stiffness anymore. And how we do that is simply, there's many ways you can do that. The continuous passive motion machine is one, post-surgically, but just sitting on a chair, you can even put a weight on your leg and just dangle it back and forth, back and forth. That's a very gentle way to get that movement to go. Another way is typically a bicycle. A bicycle does not exert a whole lot of pressure on the knee, and again, as it's set at the right range of motion, and you always do it slowly. You don't have to force the fluid, just a little at a time until all of a sudden it starts feeling better.